So welcome back to the latest episode of Taking Charge of My Cancer podcast. This is episode 93. And I have a really fun guest today with me. This is Yuval Alima. And Yuval is a third-year APK student at UF. She's from South Florida. When she isn't studying or assisting in the UF neuromuscular physiological lab, she spends her free time reading, exercise, and dancing salsa and bachata. She just completed her part-time APK internship here at the rehab clinic and plans to graduate next summer. So we have a really fun kind of summer together, and I really appreciate you, Val, you doing this with me today.
Thank you. Yeah, I'm glad to be here.
Thank you. So tell me about your role or mission, or were you always planning to do this, meaning, being an APK or apply physiology and kinesiology, pursue career as a precursor to going into some health science that you will tell us more about it. So tell us a little bit about how do you end up in this kind of path?
Yeah, so I feel like I started as the original path as many UF students. I came in as a bio major, but before as a biology major, but before I even started UF, I actually met someone at a PT clinic that I was shadowing, and he went to UF and was an APK major. I fell in love with all the classes that he took. We have to take classes like biomechanics, strength and conditioning, physiology, and these all interested me. And so as soon as preview came, I switched in and I was like, I know that this is what I want to learn. I'm not really interested in learning more about like ecology and birds and plants, which don't get me wrong, I think there's a significance to that, but I don't think that's what I am here to learn. So I fell in love with APK. I talk highly about it to everyone. I'm an APK fangirl, and I have enjoyed my experience so far. All the classes are amazing, and it led me to this internship. It has given me a lot of resources, specifically a list of all the different sites that could come to for my internship, and this was one of them, and I was like, this is what I want to do.
Excellent, very good. So I remember you coming to us for an interview, and I think that you did really well. Like, she's like you kind of like knew where you wanted. And I was kind of impressed. I was like, oh, I think that would be a really good idea, I think. And we always really picky about who we pick as an interns, just because, as you know, this is such a specialty. And no, we're dealing with a lot of oncological patients, so it is not an easy, straightforward setting. But I kind of knew that you will really will do a really great click with them, and I was not wrong. So here we are, she's at the end of it. This is her last week. So kind of so glad that you get to spend time with us, and I really appreciate all your help during this time.
I appreciate you having me.
What good resources would you advise other students in how to educate themselves or how they can be prepared better coming into this internship?
So, well, first off, I know that Blake and I are now going to start working on like documents that we can give to students before they even come in to just get a general baseline of what they're going to be exposed to here. But by any means, that is not going to be enough. My first couple weeks, even to the end, I watched a lot of YouTube videos because there is so much that you learn. And of course, I love to ask questions during patient appointments, but I don't want to take up too much of that time. So I go home and I watch a lot of YouTube videos. I look at a lot of research studies. I take a lot of notes, and that has really helped. And that is definitely something that I recommend. Maria, actually, she was a previous APK intern, and she recommended I get a little notebook. That has been game changer. I usually have been someone to just kind of mentally remember everything, but writing everything down, even like little scribbled keywords, has definitely very helped. So I would recommend getting a little notebook for sure.
Okay, great. How about for patients who has been dealing with a cancer diagnosis? What kind of tools will you give them to try to prepare them or help them more than prepare them to help them to navigate through this situation a little bit better?
So what the lens that I'm looking at this is that these patients see many different people, from someone who has been in the field for over 50 years and to students like me who have only really been exposed to this for 2 months. And I think that regardless of the specific experience that I've had like in this realm, I think that I can still contribute a lot of good and valuable information and resources to you. So I think just kind of absorbing everything from everyone is really helpful. And I don't think that you should kind of negate what I say just because I am younger or because you think I'm inexperienced. I think that everyone can really offer a lot of good things to you. And I think that you just kind of have to really take advantage of everything that you get and everyone that is a part of your journey.
Okay. Now, leading into that, if we're looking into like, if you find three tips, like if based on what you saw here in these last 3 months, and somebody comes to you, a friend, or just anybody comes to you and say, hey, I just been diagnosed with breast cancer or head and neck cancer. If you have three tips, what will be that for them?
So the first thing is I would say be aware because a lot of the times you can get a list of all of the potential symptoms, but you may not necessarily feel all of them, or you may have one of them be even more exaggerated. And everyone who has an appointment with you or everyone who sees you is there for you specifically. We're not here to treat just like whatever lists of symptoms that could potentially happen. So I would say be aware of what you're feeling. If you are feeling tight on, if you've had a surgery on your breast, if you're feeling tightness, or if you're feeling more of a pulling, or if you're feeling more of a throbbing or burning, like those different sensations mean different things, whether it's like a nerve or if it's a muscle issue. So I would say be aware of what you're going through so that we can best help you. That's the first one. And the second one, I am very, very enthusiastic. I love exercise. So I go on runs, I go to the gym. Growing up, I played soccer and volleyball. I was just very active. And so I promote exercise all the time. I know for some patients it's difficult. But even if you go walk, I think that if anyone starts off their day, I mean, just has 10 minutes, 15 minutes, 30 minutes, just walking, I think it's game changer. So that's something that I would definitely recommend. And the third thing is, like I said, I'm a very enthusiastic person. I am very optimistic. And so I try to really transfer those energies to patients, for lack of better words. And I would just try to keep that positive outlook because I know that there's definitely they're seeing a lot of different doctors, maybe not hearing such great news, taking all these tests, and sometimes it's easy for life to just keep hitting you down. So I would definitely like try to not let that really just hammer you down into a shell. Really just try to fight that.
Okay, excellent. That was very good tips. How about if we switch a little bit about for your just personal life, just going through school, and what will be something that has been painful in your journey?
It kind of goes into how I am very enthusiastic. So I it's in my nature, also just in my family, we're very direct and blunt people. And so sometimes it can be overwhelming for people. And I guess that is something that is a goal of mine in life, just something that I need to work on. Um, how to moderate how enthusiastic I am, or essentially how to gauge a patient and what situation they present to, or anyone in any scenario. If they come to me and I see that they're in a certain mood, I would still be enthusiastic. I would still be like try to get them in a better mood, but I would need to gauge to what extreme or to how to calm that down. So that was something really painful, challenging. There have been specific interactions in life as well as in this clinic where a patient has either snapped back or made some comments, and I kind of took not maybe not like took offense, but it was a blow. It hurt. And so that was something that I guess was painful because I had never really experienced that full force. And now it's just something that I need to be aware of. Like I mentioned, I don't know what people are going through in their life. They are going through a bunch of things. And I'm over here telling them like have a positive outlook. And it's not because I've have things going easier, but it's just because I think that's how everyone should live. Because regardless of what you're going through, regardless of what people say to you, regardless of what um, regardless of what happens, this is life. You gotta make what you can of it, and I think that it's you just have a good outlook for it.
Yeah, yeah, that's a perfect. And you're right. Sometimes we don't know how patient can live this type of diagnosis, right? You have patients who take it really well, like they really, like you say, they live one day at a time. They manage their mental health really well. They kind of have a lot of things down pat well. And it is some patients who don't. It is some people who really is harder for them. They are more high stress, and then for you and me, maybe we can manage a lot easier. For other people, doesn't. It creates a lot more in their mind. I guess their cortisol levels go up higher. I don't know how they react. So sometimes we just don't know. And don't feel bad, like when, if you're going to be on the healthcare field, some patients are just going to just, really get back to you just as a reaction. I don't think ever is going to be against you. I think it's just, you just happen to be there for them to just burst out. And then that has happened to me. That doesn't mean that you allow them to not be respectful to you. So I think it is important for you to just really, try to understand where they come from, but at the same time, make them understand that they gotta respect you and you're there to help them, not to hurt them. And then they come down usually to the sense of like really apologizing for whatever attitude happened. So, so I don't ever take it against you, because that's usually not the case. That's very good. What is a common question that you find patients ask you usually every time they come?
Why am I doing this?
Yeah.
So
And what exactly you mean by why I'm doing this, for the audience who doesn't know much like what we do?
So, I mean, since this is a physical therapy clinic, a lot of the times, I think that now there's a big motion for like promoting physical therapy, and now a lot more people are aware of it and are sending referrals. But people still don't understand why physical therapy is important. And even if I don't go into physical therapy, or if I do, I'm still not sure, I will scream the importance of physical therapy off of any cliff, like out to the world. Even from minor things as just not being able to lift your arm because you have some tightness. There are so many exercises that we can do that. If you feel tired, there's also exercise. If you have a lot of scar tissue, or if you've had some other procedure, or if you have, this is just in specific to what I've seen, but there's also if you have like joint pain, there's other therapists that can help you with that. I know that we also have a pelvic floor therapist who can help you with bladder incontinence. Physical therapy is amazing. And there's so many things that it can help you with. And so a lot of patients don't really understand why they come here. They're like, how can you help me? And then it's a great opportunity to say, like, I can help you a ton. Let me show you how. Keep coming. Let's do more things. Let me show you some more things. Let me give you some worksheets to help you. If I overwhelm you, because there's so much for me to help you, take some home so you can look over it with your family and have them help you understand whatever you're going through. There's so many resources that we can give you, and so a lot of times it's just a matter of us telling them what we can offer.
Exactly. And sometimes, I think that a lot of people knows physical therapy is because you have a pain, or you are, like you said before, you're unable to move an arm or your back or your neck or whatever part of your body. In the oncology setting, we see patients that they're going through radiation, and perhaps they're just beginning radiation, and that's all they have done so far. Good example of head and neck type of cancer patient, that sometimes that's what gets offered is radiation chemo. So many times they come in here and they really don't feel that there's anything wrong with them besides having, maybe a node positive on their neck, or a small cancer on their throat, whatever goes on with that. But symptoms perhaps maybe swallow have a hard time maybe talking, but in regarding movement and function, they're usually doing very well. So many times they come in to see us and they're like, I have no idea why I'm here. I'm just here because the doctor told me to come. And when we start explaining to them how like some of those secondary effects of that radiation can create and prepare them in how to mitigate those symptoms early on, sometimes that really like they come in we like have no idea what I'm here, maybe an attitude like this is a waste of my time and your time, and then they walk out of here with a different mindset. It's like, oh my God, I didn't realize how much we can help. I didn't realize maybe how much, even though the doctor has been telling them, the nurses has been telling them, it's a lot of information that come to them at once. And then when we start to really emphasize and re-emphasize and go more, spending a little bit more longer time with them, explaining step by step, they realize how much we can help. And then that's exactly what it is. So we can mitigate so many things going through any of these cancer treatments, from what you mentioned, from motion to cancer-related fatigue, to help them to just really enhance more their chemo, their radiation. So it is a lot of things we can be done, when you have a cancer diagnosis from the PT standpoint.
Mm-hmm.
And it's not just during the cancer treatment, but any sequelae that happen afterward, right? So the surveillance part is super important because a lot of the patients, and for people who I see here, people who I've been interviewing before, is like, they have a whole team that is taking care of them through the process. And when the process is over, they're alone and they're like, okay, now what? I don't know what to do now. And then what do I do with this, neck pain I have left over from this, or this chest swelling, or my arm hurting, or the cording, or whatever it is.
Mm-hmm.
And so here we are, the health professionals who can continue working with you throughout that survivorship time, for years afterward, for any kind of sequelas that those cancer treatment has been leaving to you. So I think it's important, like I say, because it's just a little bit different from, yes, I broke my hip, and then, yes, I know I need physical therapy to recover, or I hurt my ACL skin and then I need physical therapy to recover. This is a little bit different. Yeah, so it's just really a lot of education and really helping them to mitigate a lot of those symptoms.
Mm-hmm.
So that's great. How about, you have any book recommendations either for students out there who wants to go into PT and or APKs, or even you were thinking about going into PA school, or just patients who has been diagnosed with cancer? Anything you can recommend?
Well, I don't really read for like I haven't read many like educational books other than like school textbooks. I usually read um as a hobby, specifically like young adult fantasy fiction books, because I find that if I am always trying to overload my brain with everything, it kind of just becomes very overwhelming. So I read as an escape or just as a way to,
Yeah.
have a good balance.
Mhm.
So books that I can recommend for that are, well, authors, I will say, because I love all of her books, are Sarah J. Maas. She is a big one, and her books are also very big. They're like 1,000 pages long. Um, but there's actually another, um, I'm trying to remember the name. I actually can't remember the name right
That's
now.
okay. And I can add it into the show notes below so that people can find them there. That's no problem.
Uh-huh.
Yes, but you're right. It is important to have a good balance. So
Yeah.
I always say, reading, I cannot tell you the last time I read a book for fun, just because I'm always reading. On the other hand, things that are related to what I do for a living, which is this. So I'm usually end up finding myself doing a lot more podcasts, and not just talking about cancer, but how can I be, wellness, and how you can be healthier, and some functional medicine and different things on those lines. So I don't get to, when it's time for me to read something fun, it's 11 o'clock at night and it lasts me one page and then that's it. But I think it's important to balance. And then for the audience, whatever you find joy in reading, go for it, or watching movies or podcasts, which are you aware of any podcasts would you recommend to people?
This one.
Yay!
I honestly only started listening to podcasts this summer just because you mentioned that you have one, and I then realized there's a whole world of podcasts out there, from like informational ones, and then also like there's audiobooks, there's like true crime podcasts that a lot of my friends are obsessed with. So it's another avenue, because I'm not a big like TV person, so books and podcasts are just kind of great options.
Yep, absolutely. And I did not listen to a lot of the podcasts until I was introduced to one and gave me the idea to start this podcast over a year ago now. Has been really fun. And you're right, it's amazing, but it's so easy to listen to it because I listen to them on my way to work, on my way home.
Yeah.
Or if I'm driving for long distance, or
Very
sometimes if
convenient.
I'm working out. So it's really convenient. And you're right, it's so many of them out there. So you can just really use different platforms for podcasts, and you can just put in there whatever you want to listen to. And that's really very helpful. How can people find you?
I have a social media, but I'm more private with that. But I'm starting, well, not I'm starting, but I have a LinkedIn, but I'm updating it more.
Okay.
It's just like my full name, like Yuval Alima. So I'm trying to make it more robust in what I've been doing. And then an email if you want to contact me. I think that'll be really good.
Perfect. And then I will put those as well on the show notes. Is any one question that you wish I will have asked you and that you will have answered?
Oh, okay. I did. The question would be, what would I take away from this experience? So, I mean, I know it's a loaded question because there's so much I can talk about, the connections that I've made. I can talk about everything that I've learned. But as I mentioned, I'm still debating whether to do PT, like physical therapy, physician's assistants, going to med school. I honestly still don't know. But this experience has been so valuable to me that it's going to definitely be whenever I make a pros and cons list, this one's going to be definitely go to physical therapy. Like, this is what you need to do. This whole experience just shows how I can really make an impact on everyone's life, and how many people there are that really want to help you, and how even if I go into physical therapy, or even if I do medicine like oncology, I'm still gonna be related to the whole team no matter what. So even if I choose one route, I'm still gonna be talking with all the other disciplines and really just help the patient in every way that we can.
Yep, exactly. So that's very well done. I think that no matter what you end up doing, think about a patient as a whole, and you gotta be seeing it from all that whole standpoint, right? So it's not just, if let's pretend you're going to med school and you are a primary care physician, you're only gonna be looking at, oh, what are you here for? Oh, because you have some high blood sugar and we're going to talk about your diabetes. And then this, when you focus on that diabetes and you forgot, so why do we got to this point to beginning with? How about if we start to be more preventive, right? So instead of you going down with a diagnosis of diabetes, how about if we from the beginning on your physical start doing all this prevention, right? Like, let's look at your whole value, blood value, whatever it is. And if this is not looking that great, how can we do to start to make that better so we don't deal then? Because it's easy to prevent and to treat a disease. And that disease can be anything, right? From diabetes to high blood pressure to high cholesterol to cancer. So I think that we definitely need to start moving on more towards that versus just kind of just treating disease. We got to start to learn how to prevent those. And then in the other hand, if you end up again as a physician assistant, again, looking at the patient the same way, no matter on what specialty. And hopefully I always say to my students, I wanted to put that seed in their heart and brain about pursuing oncology. I think it's such a big need. We have more and more cancer survivors because we're getting better and better about treating cancer. But with that, we have some more issues with their treatments. So I think it's a big need from every healthcare standpoint, from the surgeon all the way down to social worker, mental health, nutrition, exercise, whatever you want to be on that environment. So I think that always, no matter what are you going to end up doing, and if you end up doing oncology always, or not even if it's not just oncology, but any other thing, you gotta be looking into every standpoint. Like what else is a puzzle? Like I always say to my patients, this is a puzzle and we just do a little pieces of it, but you gotta be doing other ones for us to be able to kind of really solve an issue. So but has been really fun having you today, and then has been fun working with you. Like I said, in the last 3 months, we're gonna miss you, and I know you do really well in whatever you want to do. Maybe later on in a few years, we come back to this, and then if the podcast is still running, and then we'll invite you
see where I'm
to
at.
see where you're at. And then what kind of experience you can bring us. So thanks, Yuval. I really appreciate it.
Of course. Thank you for having me. Yeah.
Absolutely. And you have a great rest of the day.
You too.